Genetics, Epigenetics, and Alternative Complementary Medicine, March 21st, 2018, by Jesse, Natalia, and Kate. The Human Genome Project. In 1990, the National Institute of Health and the Department of Energy joined with international partners to sequence all 3 billion base pairs in the human genome, which is the complete set of DNA in the human body. Completed in April 2003, the HGP gave us the ability to read the complete genetic blueprint for building a human being. Researchers can find a gene suspected of causing an inherited disease in a matter of days rather than the years it took before the genome sequence was accessible. Today, there are more than 2,000 genetic tests for human illnesses. These tests enable patients to learn their genetic risks for disease and also help healthcare professionals diagnose disease quickly and more efficiently. Based on understanding disease at the genomic level, there will be a whole new generation of targeted interventions, many of which will be drugs that are much more effective and cause fewer side effects than those available today. Pharmacogenomic studies how genetic variation affects an individual's response to a drug. For example, pharmacogenomics tests can identify whether or not a breast cancer patient will respond to the drug Herceptin, whether an AIDS patient should take the drug abacavir, or what the correct dose of the blood thinner warfarin should be. Gene mapping offers evidence that a disease transmitted from parent to child is linked to one or more genes. Mapping also provides clues about which chromosomes contains the gene and where the gene lies on that chromosome. Genetic maps have been used to find the genetic responsibility for rare, single-gene inherited disorders such as cystic fibrosis and muscular dystrophy. Genetic maps are useful in guiding scientists to genes that are believed to play a role in the development of more common disorders such as asthma, heart disease, diabetes, cancer, and psychiatric conditions. Genetic markers are characteristic patterns in the chemical bases that make up DNA. Genetic markers usually consist of DNA that does not contain a gene. But because markers can help a researcher locate a disease-causing gene, they are extremely valuable for tracking inheritance of traits through generations of a family. HapMap, developed in 2005, is a catalog of common genetic variations in the human genome. In 2010, the third phase of HapMap project was published, with data from 11 global populations, the largest survey of human genetic variation performed to date. HapMap data have accelerated the search for genes involved in common human diseases and have already yielded impressive results in finding genetic factors involved in conditions ranging from age-related blindness to obesity. Ethical conflicts. The increasing ability to connect DNA variation with non-medical conditions, such as intelligence and personality traits, will challenge society, making the role of ethical, legal, and social implications research more important than ever. Environmental justice refers to a political and social movement that addresses the unequal distribution of environmental harms and benefits in society. Epigenetic changes can adversely affect the most vulnerable segments of society. Therefore, there is a moral obligation to change the environmental sources of risk and prevent future harmful exposures. Epigenetics could shift the focus from populations receiving unusual exposure to those individuals with greater susceptibility. Also, rather than focusing on geographically defined communities, it concentrates on the individual biological factors that establish increased risk for disease development from environmental exposures. Epigenetics has the possibility to create information about an individual's likelihood of developing health problems in the future and possibly transmitting the risk to his or her offspring. The ethical concern is that since we live in a time where healthcare records are more easily accessible, there will be a breach in people's right to privacy and confidentiality of personal healthcare records. Furthermore, if one undergoes genetic testing, is it the right of family members to have that information if it puts them at risk for an inherited disease? Also, if a person undergoes genetic testing and has an abnormality due to environmental cause, is it their right to withhold this information from certain parties such as employers and insurance companies? Understanding the link between environmental exposures and epigenetic effects will increase the importance of exposed individuals receiving health services for prevention, monitoring, and treatment. Many of the individuals most likely to live and work with hazardous exposures are least likely to have regular, timely, and comprehensive access to health care. The issue arises of the equal access to health care for individuals exposed to substances causing epigenetic changes versus those who have not. Also, could persons with inherited diseases also be a risk for being denied equal health care than those who do not? Intergenerational equity refers to the idea that each generation is responsible for other generations' health and quality of life. In terms of intergenerational equity and epigenetics, the question arises, what effect does intergenerational equity and epigenetics have on modern-day environmental policies and reforms? Should environmental reform be based on other generations to come health? When it comes to epigenetics, changes from environmental harms? Also, it poses the issue that each generation should maintain the quality of the human genome and epigenome and pass it on in no worse condition than the present generation received it. Eugenics refers to improving humanity by increasing the number of genetically strong, healthier individuals and decreasing the number of genetically disfavored. This concept led to genetically undesirable individuals, which lead to forced sterilization and eventually genocide. With increased genetic testing and gene mapping, the concern arises again for having individuals who are genetically undesirable. Could that lead us down the same path of forced sterilization to eventual genocide? Ethical and legal social implications research program was established in 1990 as an integral part of the Human Genome Project to foster basic and applied research on the ethical, legal, and social implications of genetic and genomic research for individuals, families, and communities. The ELSI research program funds and manages studies and supports workshops, research consortia, and policy conferences related to these topics. Alternative and complementary therapies. Complementary and alternative medicine is often described as a group of diverse medical and healthcare systems, practices, and products that are not presently considered part of conventional medicine. In the U.S., approximately 38% of adults and 12% of children are using complementary and alternative therapies. Adult women with higher education and higher incomes using alternative and complementary therapies the most. American adults are most likely to use alternative and complementary therapies for musculoskeletal problems such as back, neck, or joint pain. Common alternative and complementary therapies include fish oil, omega-3, glucosamine, flaxseed, acupuncture, Pilates, diet modifications, massage, guided imagery, Reiki therapy, hypnosis, essential oils, pet therapy, and meditation. Impact of alternative or complementary therapies. Genetic information and technology is improving healthcare by influencing outcomes such as quality, safety, and saving costs. Alternative or complementary therapies can be designed to target the underlying disease and can help manage symptoms. The individual genetic makeup and variation can help inform the risk of a particular disease in all stages of life, such as in the prenatal newborn, child, and adult. It is used as a screening tool to more specifically depict health conditions, improve medication selection, which may include therapies that are designed to target the underlying disease genomics. Alternative or complementary therapies can inform providers on a specific way to manage symptoms. A current example of genomic medicine today is that every baby born in the United States is tested at birth for 29 to 50 severe inherited and treatable genetic diseases through newborn screening, which is a public health program. Clinicians are able to look for mutations across an entire genome by sequencing the whole genome. This gives them the ability to look for a much larger number of diseases and conditions. For newborns in neonatal intensive care units, rapid whole genome sequencing has been proven to show a useful differential diagnosis within 50 hours. Currently, a new test is being developed by researchers at Stanford University to detect when a transplanted heart may be rejected by the recipient. Right now, the only way to detect rejection is done by performing a very invasive tissue biopsy. This new approach only requires a blood sample, and it detects the levels of cell-free circulating DNA from the donor's heart in the recipient's bloodstream. Before rejection can be identified by a biopsy, cell-free circulating DNA from the donor can be elevated for up to 5 months. This new test will revolutionize organ donation by being able to detect rejection in a less invasive way. Pros versus cons of alternative/complementary medicine. Pros. Practitioners of alternative medicine address not just the physical body, but also the patient's emotional and spiritual health. According to the Osher Center for Integrative Medicine, a growing interest in a more holistic approach to health is one of the main reasons alternative medicine is on the rise. Alternative medicine practitioners, because of different philosophies and fee structures, typically place greater emphasis on one-on-one attention. Many types of alternative medicine encourage patients to have well visits, treatments that are focused on preventing disease before it occurs, in addition to being cared for when sick. Cons. Compared with traditional medical methods, evidence is still limited, which has left many questions unanswered. Many dietary supplements and herbal remedies, which fall under alternative medicine, are mislabeled as natural. Products can claim to be safe or natural, and labeling is confusing to consumers. Consumers should research products using government agencies, such as the National Institutes of Health and the U.S. Food and Drug Administration, before starting them. Even in cases when the product contains no artificial substances, supplements and herbs can still potentially interact with prescription and over-the-counter medication, and some of these natural products have side effects of their own. Risk for consumers. Patients often do not disclose their use of alternative medicines, which could potentially interact or interfere with current medical modalities that they are prescribed. Potentially dangerous side effects and interactions with conventional treatments, for instance, garlic and cod liver oil, have anticoagulant effects. Many alternative therapies do not have evidence-based research that proves their effectiveness as a treatment in illness or pain control. Some can be harmful by themselves, and consumers need to know how to research and use safely and effective products. Herbal supplements can have a negative impact on the perioperative period and may interact with conventional medicines used to manage chronic conditions. Physician-patient communication often does not include the subject of alternative medicines, leading to underreporting of use. Surgeons should adopt methods to routinely elicit from their patients the use of complementary and alternative medicine and should monitor and counsel patients on potential side effects and drug-herb interactions. Preoperative instructions should include cessation of the use of herbal supplements. Healthcare and new initiatives. The Cancer Genome Atlas aims to identify all the genetic abnormalities seen in 50 major types of cancer. Having a person's complete genome sequence will help make it easier to diagnose, manage, and treat many diseases. Individualized analysis of each person's genome can lead to a more effective form of preventative, personalized, and preemptive healthcare. Individualized healthcare based on each person's DNA will allow healthcare professionals to focus treatment on the specific interventions such as diet modifications or high-tech medical surveillance, resulting in the best health promotion for that individual. Access to screening small molecules will provide researchers the ability to explore the hundreds of thousands of proteins believed to be encoded by the about 25,000 genes in the human genome, resulting in innovative techniques to develop new, more effective types of drugs. The healthcare system is slowly responding to the increase in CAM use. Many physicians are referring to CAM practitioners or are practicing forms of CAM themselves, and new models of integrative healthcare that combine CAM and conventional medicine are developing. CAM professionals and natural health products regulation policies are being discussed. How to incorporate safe CAM treatments into mainstream care plans, and how best to protect the public from a wide range of possible CAM conventional medicine interactions are being discussed for policy and healthcare reform.